Welcome to Kenton Teaches. Enjoy the video.
You begin by getting a prescription and clear instructions from a clinician. Do this now. Once you have the medication, inspect the pack and read the label for the exact schedule and precautions. Make sure to choose and record a consistent start day so you can follow timing reliably. If your clinician tells you to start on a specific cycle day, follow that guidance. Keep the prescription and any patient leaflet accessible. They'll guide the next steps. You now follow the dosing schedule your clinician gave you and use reminders so doses aren't missed. Alarms, apps, or a marked calendar work well. While taking the medication, monitor how you feel and note any new symptoms. Write down timing and severity. Once done, make sure to attend any follow-up visit the clinician recommended to assess effectiveness and tolerability. If you're using other medicines, tell your provider to check for interactions before continuing. You finish the prescribed course exactly as advised and avoid stopping abruptly without consulting your clinician. If you miss a dose, refer to the instructions given by your provider or contact them for tailored next steps. Do not guess. Once the course is complete, report any lingering symptoms and confirm next contraceptive or follow-up plans. Troubleshooting tip: if you experience worrying side effects, heavy bleeding, fainting, chest pain, seek medical attention immediately and inform your prescriber.
Thanks for watching. Please subscribe if this video was helpful.